Now, it says here that you did 75 hours, but this was between September 2010 and June 2012. So that's about that's, what, 21 months?
In outpatient treatment? It was
Yeah,
a long time.
yeah.
I know I was there close to 2 years.
Why did it take you so long to finish the treatment?
That's just the way they set it up. Maybe they thought I was a hard case. I don't know.
Okay. Well, what do you think?
What?
Do you think you got anything out of treatment, or do you think you were a hard case?
I did. No, I did great in that program.
Okay. Tell us, and I know it's been about a year or so, well, 6 months since you got out of treatment. What do you remember from the treatment? What did you learn in treatment?
We talked about what alcoholism is. I remember you were reading some of those things off. I remember some of that back then they were talking about. They were trying to define alcoholics. We talked about talked a lot about my personal past and why I was the way I was, or had become what I, you know.
Are you referring to somebody with an alcohol problem or a gang member? Or both?
Both.
Okay. And so I guess you've already kind of explained why you became a gang member.
Yeah.
And you think your drinking and drug use is a direct result or consequence of being a gang member?
I think that's a big part of it, because I wanted to be like those guys.
Do you think, that may not be a fair question. I'll ask it anyway. Do you think you may have developed a drinking or drug problem even if you had not become a gang member?
I have no idea. I don't know.
Okay.
What would
Do you
happen.
come from a drinking family?
Not really. I never knew my father. My mother was murdered,
Okay.
and my grandmother didn't want it around.
Okay. The treatment was provided by the agency which did the update. So apparently during the course of treatment, they decided that your classification was incorrect. It says here that he completed group treatment totaling 75 hours, completed all goals identified in his treatment plan. He was active in treatment with good insight and a willingness to demonstrate altered behavior, including reports that he has maintained abstinence from alcohol and is incorporating non-alcohol related leisure activities into his life. So other than in prison, did you ever abstain from alcohol?
Before, just in the last, before that treatment program, no.
And did you abstain during treatment? That would mean that you didn't drink anything for over a year and a half. But
No, I cut back on my drinking.
okay, so when he says he was active in treatment with good insight and a willingness to demonstrate altered behavior, including reports that he has maintained abstinence from alcohol, what is he talking about? What period of time is he talking about?
I don't know. I don't know. I was honest with Ann there, that I was drinking one beer a week
Yeah, and that's what's in the update.
on Wednesday night.
Okay. The client was able to verbalize his understanding of the consequences of drinking and driving and all objectives in accordance with the treatment plan. He has taken ownership for his dependency of alcohol and his DUI arrest. His progression through treatment was fair, and he has been successfully discharged from the program. Okay, you said that in treatment you learned what alcoholism is.
Yeah.
Give me a simple definition.
Alcoholism is when a person has to have alcohol, and once they start drinking, they can't stop. They start, and they may say they're only gonna drink 2, but they end up drinking till the bar closes.
And are you saying that that doesn't describe your drinking?
No, I can control my drinking.
Okay.
I have for the last 18 months or more.
Okay. And you feel comfortable with your current drinking pattern?
I do.
You think you can maintain this drinking pattern indefinitely? If you want to? Do
I think so.
you think you could drink, do you think you could not drink? Drink nothing if you wanted to?
1 beer is almost like nothing.
Okay.
So,
Under a summary of participation in treatment and understanding of condition of discharge, it says Mr. Mays' participation was fair throughout. He was able to discuss emotions and behavior at times. Condition of discharge was fair, with an action plan designed to assist in preventing future problems. He was somewhat involved in treatment process and discharge planning. This is a dual diagnosis program, and he was treated for an adjustment disorder with anxiety. Has successfully completed that treatment. He currently exhibits no symptoms pertaining to his adjustment disorder issues and is now off and is no longer in need of any medication. So at some time you did use some kind of medication.
they gave me, for a while there, I was on Celexa,
Which is what?
antidepressant, anti-anxiety,
And you haven't used any medications in
No.
about how long?
since I quit with the outpatient there.
Now,